I'm with Tim Bomberry, and he is a COVID-19 survivor. How do you feel about the term survivor, actually? I didn't use that one before, but how do you feel about the term survivor attached to COVID-19?
You know what? I guess it's all right to be called a COVID-19 survivor. You can decide, I guess, once you hear what I got to say.
So let's talk about the COVID-19 situation for yourself. Can you kind of get as much detail as you want to give, the how and the when? How did you get it, and when did you kind of know, okay, well, this is something serious?
Okay, so let's see. So March 17th, my son Tyson, he was living down in New York City. Well, Long Island is where he was living because he was playing in the NLL for New York Riptide. So he was living down there through the winter. And then, Niagara, New York City got hit hard with the pandemic. And then the NLL shut down. So we told him, well, don't be staying there. Move back home. So he was moving home. So he got home on the 17th of March. He got home like late Tuesday morning or early Tuesday morning, 4 a.m. Didn't see him. He went right to right to his room, kind of thing. That same day, I had to move my youngest daughter out of her dorm at Western, University of Western. I had to move her out of her dorm that day because the university was
they shut that down too.
Yeah. So I went out there, her and I, and so we left at like 6 in the morning. So I didn't even see him, and we left. And when we got there, all the parents were moving their kids out of the dorm. Right? It was like moving day.
Mm-hmm.
Right? So I said, well, you stay in your room, and you basically kind of pack it up, and I'll take it out. I'll do the running in and out. So I was trying to stay away from people, using the alcohol on the hands, but the mask thing wasn't really a deal back then.
Yeah, it wasn't being enforced as hard as it is right now.
Yeah. So I didn't have a mask on, but I was washing the hands as often as I could, trying to avoid people, but you're moving in and out of the halls, and we were there for a couple of hours and tons of other people. Moved her home. That was the Tuesday. Tyson at that time had a cough, and he said, I don't think I have it, but I should get tested. I said, okay, well, get tested because you come out of the hot zone kind of thing. So I let him know at work, because I work with Six Nations Police. I said, this is what's going on, and they said, okay, you self isolate too, like stay. And then my guys who were working with me in my shift or my unit, they had to self isolate too. So we were getting 14 days off to stay home. So I said, yeah, okay. And I didn't think nothing of it.
Mm-hmm.
I just said, you know what, all right, I get
14 days off.
14 days off, gonna chill out. And I gotta do things by myself. I got a bush behind my house. I go for a hike, go for a walk. I'll do stuff.
Mm-hmm.
Because I do it just, within my household.
Yeah.
So I was good with it, never thinking I was gonna get anything. Saturday morning, I had went for a run. So that was Tuesday. Come to Saturday, so this 21st of March, I went for a run, and then I started coughing after I got done running. Didn't think nothing of it because it's March and it's cold. And then it just got progressively worse. And then I think it was on the Tuesday following that. Now I got a fever. Like I started getting a fever on the Saturday. Couldn't sleep. I had to sit up in a chair. Like I said, we had a foam roller. Those foam rollers.
Yeah.
About 3 feet long. I couldn't lay down. I couldn't sit back. I had to lean forward and just put my forehead on it and sit there like that and try to sleep. And I maybe get an hour, maybe, of sleep. And I said, I maybe I better get tested, So I remember the ambulance paramedics came on a Tuesday. They were all PPE'd up, come to the door, and I just opened the door of my house and kind of stuck my face out. They stuck that tester up my nose, and it's okay. Well, we'll get back to you as soon as we can. It's all right. And I stayed. I went to the hospital at some point during that time, and I can't remember if it was before they came. I think it was before they came back with the COVID positive thing. They take a X-ray of my lungs. They said I got smattering of stuff in my lungs. And they said, well, you know, it looks like pneumonia, right? So, okay, I got pneumonia. It's not COVID. And then on a Friday that week, and I still couldn't sleep. I got headaches. I got chills. I'm coughing uncontrollably, like uncontrollable coughing, and I can't breathe. And chills, fever, and on Friday they called and said, okay, you got you're COVID positive. So all right, and then I stayed home till Saturday. And Saturday, like say late Saturday, early Sunday morning, at 12:30 or 1, I told my wife, I said, I can't do it. I said, I can't breathe. So we called the ambulance. They hooked me up. They took me out to Brantford General, and they got me there. They took another X-ray, and now my lungs are like full of crap, basically. Then they had me isolated in the one room of the emergency, and then they got out, like they were all kitted up and took me up to the COVID wing. And I remember coming out of there, and like it was plastic coverings,
Yeah,
get into the wing kind of thing, right? So I was sitting in that hallway there. They said, okay, we'll be right with you. And it was a dark hallway, you know, and you're sitting there, and it's pretty quiet, and there's no lights on either, right? So you're just kind of looking around. I was looking around, you know, this kind of sucks.
mm-hmm.
And then, so they put me into a room, and thankfully there was a guy there. His name was Keith. He was in the room, because you know, by the looks of it, it felt like I was the only one in his wing, is what it looked like, right? And then when I got into the room, I saw, there's another guy anyway, and he was sick. So it was good. We got shooting the breeze there, you know, and it was like 2:30 in the morning now, but neither one of us can sleep because we're coughing and you can't breathe. So, you know, we talked, hooked up the oxygen, and I was hooked up, like I said, hooked to oxygen. They checked my blood, take blood every day, like six tubes of blood out of me, and then give me needles in my stomach for stuff. Doctor come in, and he said, you know, you're in a bad way, like you're pretty bad. Are you willing to take an experimental drug? And I said, you know what, man, whatever I gotta take, I'll take. So at the time, the thing that was you know, what the Donald Trump medicine, right? The hydrochloroquine and remdesivir, I think it was the cocktail or whatever. And I said, yeah, I'll do it. You know, I'll do it. And so they give it to me. I don't know if it worked because I didn't feel any different.
Yeah.
You know? And then, but yeah, that was the start of it anyway. I don't know. If you want to ask
Yeah,
that.
no, and that's interesting because it seems as though your case, especially being kind of the earliest case, right? You know, we as a community, the public really found out about COVID around January, February, but in terms of like cases and like when we really started to be worried about it was around mid-March, and that is exactly when you got hit with it. So when you're kind of dealing with all this stuff, you know, you alluded to, you just brought your kids home and now you have to isolate. And how does that work? Having, you know, your family with you in your house, you have this, I guess we're calling it a disease, and yeah, kind of take me through how that worked out.
So when they got home, and again, and I think this hits to everybody, you never think that you got it. Right? And I didn't think I got it until they told me on the Friday that your test came back positive. But we knew that we had to self-isolate, right? So once the kids came home on the Tuesday, okay, we were all of the opinion that 14 days we're going to stay together.
Okay, so all of you just kind of stayed in the house together.
Yes.
Okay.
So we all stayed in the house, and like I said, you know, we'd go outside, but we couldn't go to nobody's houses. So I said, most of the stuff that we do or I do is by yourself anyway.
Yeah.
So to go back to bush or nothing, ain't nobody around. I'm not doing nothing to nobody, you know. But yeah, we stayed in a house together. So, but because we didn't think you had it, and I'm coughing, we're sitting around in the living room together, and I'm coughing all over the place, right? Like, and you see on those things where they show how far the cough, you know,
the projectile
goes. It goes all over. So I was just covering everybody in COVID anyway, like in my house. Right?
So did the rest of your family end up getting it too?
Everybody got it. My wife, my 3 kids, and we all got it in various stages. Like,
okay.
So like I said, my boy, he just had a bit of a cough. That's all he had. My wife had it pretty good, like not pretty good, but pretty
as good as it's gonna be.
So bad, but so she was coughing, headaches, chills, trouble breathing, but not to the point where she couldn't breathe, but still shortness of breath. My one daughter, my older daughter, she had the same kind of symptoms, but she lost her sense of taste and smell. And then my youngest daughter, the one I got brought back from Western, she was the next closest to her. I was sick, and her mom thought she was going to have to send her to the hospital.
Yeah.
Like, so she was pretty bad.
So can you, and you have a whole family that you can really talk to about this, talk about like the lingering effects physically for you guys. You know, you sound like you had it pretty bad. And like you said, your other daughter had it pretty bad as well, but the rest of the family seemed to be all right. So like, do you have lingering effects physically, or does anybody in your family have effects physically since then?
One of the things, like, I don't have any lingering effects that I feel.
Okay.
I know that after my doctor told me I have scarring in both my lungs. But he said my bronchial, the branches restructured themselves.
I'm sure you learned a lot of new words from talking to these doctors.
Oh yeah. Like, I don't know these words normally, you know what I mean? Or even the processes, you know? But I know that, like, the recovery thing for me, because I was in the hospital. I was sick for a week before I went in the hospital. I was in a hospital for 14 days. The first 3 days, like up to that 10-day, 7 to 10 day, they tell you that those are the worst days, 7 to 10. That's the truth. Like, on the 10th day, I thought I was cashing in.
Yeah.
Like, the docs told me, you know, like, they kept coming in at every one of their shift thing to look at me so they could see, because of my numbers, I guess, were really crappy. Yeah. Like, real bad. So they would come in and look at me to make sure I was still with it, kind of thing, because they wanted to put me on a ventilator. And I didn't want to go on a ventilator because at the time, you know, like, ventilator was instant death. Like, you know what I mean? So I was like, no.
That's the Grim Reaper right there.
Oh, yeah.
Especially in that early onset when you really don't know what's going on.
Yeah. So I said, no. I said, I'm good with the oxygen. Just keep feeding me the oxygen. I said, if I go unconscious, put me on the ventilator. You know, go ahead, do it. But not till then. So they said, okay, you know. So, but the 10th day was the worst. That's where I thought I was gonna die then. Yeah. You know. But after that 10th day, the fever broke, the headache went away, because that was the worst headache I ever had for that 5-hour stretch from 10:30, or 7-hour stretch from 10:30 to 5:30, that I ever had. And I thought I was gonna pass out from the headache. That's not being able to breathe. But the next day it had went away, those things, like the headache and the fever. And then after that, I was, you know, pretty much good to go. Not good to go, but I mean, determined that, you know, we're gonna get through this thing.
Yeah, you felt more confident afterwards. You're like, okay, I'm out of the woods, I suppose.
Yeah, for sure.
How does this kind of affect your job? You know, your job involves you working with a crew of people, and involves you dealing with the community, and, you know, there is a stigma with COVID that you have this disease that now I'm going to get, even though you've had it and you've recovered from it. But there's a stigma automatically that you are now going to pass it on to me. And because we want to take care of ourselves, we don't, you know, treat people appropriately. So how's that been for you going back to work and knowing that you had this, and how people kind of treated you since then?
Well, I know that, like within our organization there with Six Nations Police, we're taking those steps to make sure everybody's safe, right? I mean, and you guys more as well, like you talk about your cleaning staff.
Yeah.
Our cleaning staff is constantly going. We have a company that comes in and does this. I can't remember, some kind of decontamination stuff for the
Just sanitizes the
building.
building.
Oh yeah, with a sprayer. You know what I mean? They kill everything, kind of stuff. So that's there, but then also, and it was good. Like everybody was good. They understood, and a lot of thing is like once you have it and you recover, provided you're getting tested and you're negative, and then you shouldn't be passing it on, and you have some level of antibodies within you, right? And my doctor had told me, he said, well, the worst, again, this was back then, but it says that the worst, when you have it, if you got it real bad, your antibodies will last a little bit longer, right? And really, they don't really know how long that you'll have them. But for me, I didn't feel any stigma. I didn't feel any. Everybody was still normal. They'd ask, they would ask about, okay, how you feel or anything like that. But I know everybody after that, if they had a cough,
It's your fault.
yeah, well, it wasn't my fault.
Yeah.
Nobody blamed me, but right away it was like, oh, I might have COVID.
Yeah.
So then you're off work, and at the time, like, it was like 14 days or until your test came back, which takes a while.
Yeah.
For your test to come back. So it was always always in everybody's mind, and I can't even say in the back of anybody's mind. It's in the forefront, right? So anything you do, you're always thinking about that. Right?
Mm-hmm.
We deal with people all the time. We're in close contact. When we have to arrest people, we have to touch people. So the PPE was really important, and it's it's something you have to do consciously all the time. So it's kind of wearing on you mentally to make sure you're following all these steps.
It's an added component to your mental checklist, right?
Yeah.
When you leave the house every day, it's cell phone, wallet, keys, and your lunch. That's kind of what normally we go through. But now it's like, gotta have a mask with me, maybe keep some gloves with me. Do I got my hand sanitizer? There's a few more components added to that. So, we talk about the job. Now, the job also has you potentially breaking up large gatherings.
Yeah.
And we have seen an uptick in large gatherings since the midway of summer, when people are feeling a little bit more confident. And then we just had Thanksgiving. Obviously, Halloween's just around the corner. Christmas get-togethers are, 9 weeks away. So what's your kind of thought when you have to break up these parties and you see people kind of abandoning all rules, and having gone through your experience, you must just think to yourself, oh my God, you guys are fools.
You know what? Hearing that, I know that, like myself now, I'm not on the road. Like, the younger guys are on the road. I'm in a different position now. So I do feel for them because they are the ones that are going to have to go there. You know what I mean? And that's one of the reasons I came in to do these, because I see the numbers going up. We're involved in the emergency control group, and I'm going to say this right off the thing is, people have to realize it is a pandemic, right? It is a pandemic. I had severe problems with this virus, and it almost killed me. And that's why I come out to say, you know what? And part of those large gatherings, you want to educate them, right? And that's one of the very first things is, it's not that we want to have to charge somebody or we want to have to give anybody a ticket. We want you to be educated on, hey man, like, this stuff's real. And while it may not affect you, you're going to go to whoever your people are. And when I say your people, I mean your family, your close, intimate family. And maybe they have an underlying condition. Maybe they got diabetes. Maybe they're older. Maybe they got high blood pressure. Those are underlying health factors that makes this virus more severe. And they could end up, if you get exposed and you take it home, they could end up getting it, and they could end up in the hospital, or they can end up dying. And that's what we want people to know, is to follow those rules. Like, follow the safe distance rules, follow the gatherings, right? Then we're going back into stage 2, right? Backing off a bit. Or I mean, tightening up, I should say. Where, you can have 10 people inside and social distance, wear your mask, or 25 outside, social distance, wear your mask. And those are the things they're finding that are keeping people, for the most part, safer, right? So definitely, I just think people are really gambling with not only their own health and safety, but those that they care about around them. That's how I look at it.
What do you think about this notion of flattening the curve? That's the thing that was really hammered home in March and in April, and it continues to be. We got flatten the curve, flatten the curve, flatten the curve. What do we need to do in order for that to be a realistic possibility, or is it even a realistic possibility?
Well, if anything, what they've learned from different pandemics through the time, right? You can look back at 1918 when the Spanish flu happened. That was a pandemic. And they seen through that, like it's history, the second wave was way worse than the first wave. And they've learned from that, right? Like that thing killed 50 or 55 million people around the world, right? This here now, this second wave already, even in our community, like you're not even looking at the world, but looking at our community, there was, I don't know the numbers behind how many cases there were back in March and, when it first came on. But I know it was below what it is right now.
Yeah.
And now we're in the second wave. This is the second wave. And like you said, people get complacent, right? Summertime, everybody kind of loosens up. Like you start forgetting about it. But now more people are getting this. More people are getting it in the second wave. And that flattening the curve, I believe if we stay doing the parties, if we go to parties and we live our life without any reins, without any restraints, those numbers are going to go. But if we do those things that are, that the health care professionals are putting out there, they're putting it out there so it's to save lives or to save people from having to, because what's going to happen is this, right? And I've been reading up on it, especially about it. If we overwhelm the hospitals, like I told you, I went there and I felt like I was the only one in this COVID wing. So I got good treatment.
Yeah.
They took me in, and I'm telling you, the Brantford General Hospital, the workers there, the doctors, the nurses, they were awesome to me. They took great care of me. I got no complaints other than I wanted more food. That was it.
Yeah.
Okay. But say Six Nations now has 5,000 people get COVID and they're hitting the hospitals. Brantford gets it. We only have so many hospitals around here that can take them in. So now, and then there's only so many ventilators at each hospital. And if you're that sick, if we get so many people that sick, well, now it's a lottery, How old are you? Are you 63 and you got sugar and you got high blood pressure? And I got a 29-year-old over here who's perfect health other than COVID, and I only got one ventilator. Guess who's not getting the ventilator? It's not going to be the 63-year-old with sugar and high blood pressure. It's the person we think is going to live. That's what happens when you get inundated with sick people at hospitals that can't stay up with it. They just cannot do it. So now you're on your own.
It is a tough situation. I think that's something that's been forgotten because that was the rush at the beginning. Was we were hearing all these stories that hospitals don't have enough equipment. It is that lottery system, and now that things had slowed down and then have ramped up a bit. I wouldn't say in certain sections of, let's just say, Canada or even Ontario. Let's go Ontario.
Yeah.
Certain sections of Ontario are a lot higher than others.
Yeah.
So that's, a positive thing, I suppose, that it's not kind of universal across the board. But there is that notion that if too many people get sick, there's not enough there to treat them. And I think that is one of the forgotten points of the early onset of COVID back in March and April, is that there was not enough equipment available. And that is why a lot of people ended up dying from it is because of that whole lottery system. So kind of to wrap it up, you've given a lot of great advice, but if you could just kind of put a bow on it and give, your advice to those who are listening that either, are being quote unquote reckless, and I don't want that to be attached to anyone specific, but to those being a little bit more reckless, a little bit overconfident, and to those that maybe aren't taking it as serious as maybe they should be.
Yeah. Okay. Well, what I would say is this: I never thought I was going to get this virus. Never thought it. I'm pretty healthy. Like I said, I did get diagnosed with diabetes in January, and I was like borderline diabetic kind of thing. I wasn't like off the charts. It was just like 8, and 5 to 7 or something is normal. So I never thought nothing, right? And it almost took me out. Mm-hmm. And I was like, and it was pretty crazy, right? Like, and in the recovery phase, it took all my effort and attention and focus to do it. So to get back to normal for me. If you realize, like, this is what I want people to realize, it's a hard thing. If you get it and you get it bad, it's not going to be easy. My cousin, he got it bad. He got put on a ventilator. He was in the hospital for a month. They brought him back twice. It is real. It is real as real can get. And now he's 5 months out of hospital, and he's still dealing with lingering effects. He doesn't have it anymore, but he has the lingering effects. Loss of hair, shortness of breath, fluid in his lungs, like just so many things, brain fog. Like he couldn't even remember to shake the salad dressing to mix it up. He was taking the oil out, pouring all the oil into a cup and then trying to get the stuff at the bottom. Like forgetting these things. This is what this virus can do to you. You're doing a crapshoot if you think, okay, I'll get it and I'll be the one guy who gets a little cough. You don't know it. And you don't know it about the people that you're around, like I said, who your intimate family members are around you, or your intimate friends. They could get it worse, and that's what I would say to people is take it for real. Do the things that we're supposed to do, the social distancing, and wearing a mask, and hand washing. Do those things, and hopefully. We'll all get through this, and for the better, because whatever don't kill us make us stronger, kind of thing. And I think really that's everything I can say, right? That's everything I could really say with a bow, kind of, as you say.
Well, thank you so much for coming in and sharing your experience with me today.
Yeah, you know what? Like I said before, to the healthcare workers. Normally, I wouldn't never do this, right? Go on the radio and talk. I wouldn't normally, but I see the numbers going up here at home, and I think and anybody does it. You get lackadaisical or cavalier, however you want to say it. But sometimes things need to. You got to bring it out and tell you this can be the hard truth for you if it ever comes around. So you need to know.
Thank you so much.
Yeah.